When I was in my training to be an eye surgeon, our boss at the time was somebody called the program director, and his name was Paul. Paul was amazing. He was kind, he cared about us, and all he really wanted was for us to be great doctors. So the funny thing was, I knew from the very beginning of my training that I did not necessarily want to do eye surgery or cataract surgery. I wanted to do plastic surgery, which is what I do now. And Paul knew this. One day he walks up to me and he says, "Kian, I need you to help me write a book chapter. It's going to be on cataract surgery. And it's also going to be on how to get informed consent or permission for cataract surgery." So in my mind, I'm thinking, I could not think of something that I would less want to do right now than to A, write a book chapter that nobody's going to care about. Because when we read our textbooks, we kind of just go straight to the hard science stuff, the stuff that they might test us on the board exam. We're not going to look necessarily at the more soft science stuff about, how to talk to a patient, how to get permission. On top of that, it was on a topic that I just didn't really have a passion for, which was cataract surgery. Of course, I said, yes, of course I will do that, because Paul was amazing and he was a great mentor and I wanted to help him and I didn't want to say no to him ever. So I did this chapter with him where I wrote about how to get informed consent for cataract surgery. And in the process of all of this, I figured out that being able to actually ask a patient's permission for surgery and ask them and talk to them about what the risks are for surgery is probably my most important role as a surgeon, because ultimately it's the patient's decision to decide if they want to have surgery, and it's my job to give them the information they need to make that decision. And that's what informed consent is all about. So in this video, I'm going to be talking about informed consent for oculofacial plastic surgery procedures. 5 procedures that I commonly perform. If you're new to our channel, my name is Dr. Kian Eftekhari and I'm an oculofacial plastic surgeon. I've been in practice for almost 10 years. So when we talk about consent for surgery, I want to first emphasize that this is information that I give to my patients. I'm not going to be able to extensively cover every possible risk of every surgery I do, but I want to give you a general idea so that you can feel comfortable about considering eyelid or oculofacial surgery and understanding what could happen as opposed to what we hope happens. When you come to the doctor, what you're hoping for is a great outcome, and that's what the doctor's hoping for too. The problem is that medicine is imperfect and sometimes things happen, and it's important to know what those things are and how likely they might be, and having that conversation with your surgeon. So before we talk about specific types of surgery and the specific risks to that surgery, it's important to understand that any surgery has risks. There's always a possible risk of things like bleeding, although that's quite rare around the eyes, infection, and then also there's always risks of scarring and anesthesia. You got to remember that as any type of procedure where we make an incision on the skin, there's going to be a risk of scarring, there's going to be a risk of bleeding, and there's going to be a risk of an infection. Anytime you have anesthesia, whether it's just local anesthesia in the office or general anesthesia in the operating room, there is some risk to the anesthesia. So keep that in mind with any procedure you consider. So let's talk about these 5 procedures. Number 1, kind of going from the top down, starting with forehead lift surgery. So when I do a forehead lift, I'm making incisions usually behind the hairline, and that helps to elevate the forehead. And the way I like to tell patients about it is that it's almost like we're taking the outer half of the eyebrow and we're turning it a clock hour upwards or even a half clock hour upwards. That's all you really need in most cases to be able to get that definition and that rejuvenated look of the eyebrow and the forehead. So when I do a forehead lift, I'm going behind the hairline, and so that incision is going to be in the hair. Sometimes after surgery, you can get hair loss around the incision. Scarring wise, you will feel that incision, but you may not see it long term because it is hidden behind the hairline, and depending on how thick your hair is, some men, that's not so great, it might not be visible behind the hairline if you have thicker hair or some hair there. If you're non-hair bearing there, if you've lost your hair there, then the conversation about scarring becomes a little bit more of a difficult one. Second risk specific to a forehead lift, super important to remember. When we do a forehead lift, we're going kind of all the way down to the corner of the eyelid there in the eyebrow, lifting that area up. And in doing so, crossing underneath the most important nerve that helps you lift that part of the eyebrow. That nerve kind of goes from just in front of the ear to just above the eyebrow, right along there. That nerve can be injured during surgery. It's rare. It happens less than 5% of the time, and when it happens, it's usually a temporary injury that does recover. However, less than 1% of the time, you can get a permanent injury of that nerve, and what that would mean, unfortunately, is that the eyebrow would droop a little bit. So you have to understand forehead lift surgery does carry that risk of nerve injury. Next, we're going to talk about procedure number 2, upper blepharoplasty surgery or an upper eyelid lift. So that's where we're removing extra upper eyelid skin on the upper eyelid and trying to get more tarsal platform shell, which I talk about in another video, which is basically the distance from your eyelashes to where that fold starts. That's the purpose of an upper blepharoplasty. So with an upper blepharoplasty surgery, we are removing the extra skin on the upper eyelid. We're not removing all of the extra skin because you have to have some skin left around for you to be able to safely close your eyes when you blink or when you sleep. However, one of the risks of surgery is that too much skin gets removed, or for one reason or another related to that or the scarring, the eyelid doesn't close afterwards. That is all of my patients' worst fear, is that their eyes won't close after surgery. This risk is rare, especially in the hands of an experienced surgeon who's been doing this a long time and specializes in eyelid surgery. It's not that common. But it's important to know that anytime we remove skin from the upper eyelid, we always have to know that we need some of that skin left over for us to be able to close our eyes. Second risk specific to upper blepharoplasty surgery is something we already talked about, scarring. Usually the scar, if hidden in the natural eyelid crease, is not noticeable. It can heal very well over time. Sometimes though, you can get what's called a hypertrophic scar, which is when the scar gets thick and elevated, and that can require some potential more treatment to try to treat that scar. Lastly, and this is kind of one of those things you don't want to hear, but it's true, is that sometimes we remove as much extra skin as we can, and yet after surgery there is residual skin left over. Now that might be because the procedure kind of pulled down the eyebrow, or it might be because the skin just kind of swole up after surgery and kind of distended a little bit, stretched, and then it kind of overlays again. This is a very common thing actually, that sometimes there is a little bit of extra skin left over, and sometimes we have to go in and do a revision after surgery. But it's important to know that is one of the risks of upper blepharoplasty surgery. Third procedure we're going to talk about, ptosis repair. So ptosis repair is a surgery to fix the muscle that lifts the eyelid, especially if the attachment of that muscle has kind of detached. The analogy I like to make for this is a Roman shade. A Roman shade has a bar at the bottom and it has fabric above the bar. When you pull the string down, the bar goes up, and sometimes the fabric above it can pleat. So the purpose of ptosis surgery is to raise the bar, open the aperture of the eye so you can get more peripheral vision and your eye doesn't look as droopy or sleepy. Problem with ptosis repair surgery, risk of complications are, number one, sometimes we don't get the eyelid as high as we would like, and the eyelid still has some residual droop to it. Ptosis repair surgery has about a 90% success rate, so chance of this happening is about 10%. That's not a very low number. It can happen, and I do see that in my practice. Number two, and this is even harder to treat, the eyelid gets too high. So if you get so high that you can start to see white above the eye, that means that the ptosis repair was kind of overdone. And sometimes we have to go back in and lower the eyelid somewhat, as if we open the window too much and we're getting too much light in, or the appearance of the eye is not the way we would want it to be. Those are the two main risks of ptosis surgery. And along with that, similar to upper blepharoplasty, there is a risk that if the eye is too open, it has a hard time closing afterwards. Okay, so we've talked about forehead lift, upper eyelid lift, and ptosis repair. Now we're going to go into the lower eyelids. So lower eyelid blepharoplasty is a procedure I commonly perform for bags under the eyes or dark circles under the eyes. There can be a lot of different ways to do this surgery or approaches to it, but in general, the risks are going to be pretty similar depending on how the surgeon does it. So when you go in and you work on the fat that's underneath the eye that's pooching out and causing that appearance of a bag or a dark circle, in between those pockets of fat, there is a muscle that helps you move the eye. It is rare to injure this muscle with the surgery, but it is possible. If this muscle gets injured with surgery, you could have double vision after surgery, and that is one of the risks of lower blepharoplasty surgery. It is certainly possible that double vision will be temporary and go away very quickly, but in even rarer cases, it can be permanent. Second thing with lower blepharoplasty surgery is that there might be some residual fat. It turns out the way that your fat sits when you're sitting up versus the way that your fat sits when you're lying flat on the operating room table changes how the fat sits. If you want to have a fun experiment, take a picture of bags under your eyes and then take your phone, lie down and take a picture of yourself lying down, and you'll pretty much see that the bags go away. That's because of gravity, and that can also change how the surgeon is approaching things during surgery to try to exactly identify how much fat needs to be either removed or repositioned or put in a different place. Therefore, sometimes after surgery, there can be residual fat left over, and that's something that you can treat afterwards, but it is a risk of surgery. Alternatively, there can be a hollow appearance if too much fat is taken. And that can be a little harder to treat after surgery. If too much fat is taken out, that hollowness is something that is hard to restore, although possible. The last thing with lower blepharoplasty, and this is true, like I said, with any surgery we do, but it's particularly important to think about with lower blepharoplasty, is that if there is bleeding during surgery, or more importantly, after surgery, that bleeding can track back and cause pressure on the eye. That could result in vision loss. It's not something we get excited about talking about, but it's important to know that with any surgery around the eyes, particularly with lower blepharoplasty, there is a very small but important risk of vision loss. Now, how can you feel better about this? Or how can we try to prevent this? Super important. Make sure you stop blood thinners before surgery. If I need to say that again, I will. Stop blood thinners before surgery. Things like Plavix, Coumadin, Eliquis, Xarelto, those are the heavy hitter blood thinners, but aspirin actually is really bad. And that's something that a lot of people take every day just as a prevention. The other things that can actually thin the blood are things like ibuprofen, Motrin, and Aleve, Advil. Those kinds of medications can affect your platelets. Tylenol is safe if you're having pain. That is one that does not thin the blood, but can help with pain. You want to stop those medications, those last ones I mentioned, for about 7 to 10 days before surgery. If you're on one of the more heavy hitter medications like Plavix, Xarelto, Eliquis, or Coumadin, you need to speak to your doctor and your surgeon about whether you're allowed to stop those medications prior to surgery. The last procedure that I want to talk about, number 5, is fat grafting. So fat grafting or fat transfer surgery is where we take some fat from elsewhere in your body, typically the inner thighs, sometimes around the belly or the flanks, and we use that fat like a filler to restore some of the volume that you've lost in your face. Fat grafting is a great option to augment many procedures around the eyes, but it's important to know that there are some risks. Number 1, I tell every patient this, the fat partially will get resorbed. So some of the fat is going to go away. It's really hard to predict exactly how much. It can be 50%, it can be all of it, it can be none of it, but usually it's around about 40%. That's what I tell people. And it depends on what kind of fat is put in and just how your fat behaves. So some of the fat is going to go away, and that's important to know. The other end of that spectrum is that sometimes the fat is too much or can clump together to where you have these deposits or lumps or nodules under your eyes or around your eyes, and that can be something that is a risk of fat grafting surgery. The other risk of fat grafting surgery that's important to mention is the risk of infection. So all my fat grafting patients get antibiotics as a prophylactic therapy after surgery, but it is a risk with the surgery. Lastly, with fat grafting surgery, as the fat can sometimes get resorbed, it's possible that we have to do it again to restore some of that volume. Usually people will have some pain or discomfort, honestly more around the areas that we take the fat from, as opposed to in the face where we put the fat. That's usually less painful. So it's important to know there is some discomfort after that surgery. So those are the 5 most common surgeries that I perform. It's important to know that there are some risks of surgery. I always tell my patients, I'm not trying to scare you out of surgery by telling you these things, but it is important to me, especially given that I have authored chapters on informed consent. I want you to understand what you're undergoing as far as surgery goes, because it's important for you to be part of that decision, as most surgery around the eyes is an elective surgery and is something that you choose to do. If this video has been helpful to you, please comment below. If you have any questions about other procedures or other risks of surgery, feel free to comment below. And again, as I mentioned, this is not an exhaustive list, but it is a list that I work from when I'm working with my patients to kind of tell them what the possible expectations are after surgery. I hope this has been helpful, and if it has been, please subscribe to our channel to check out our other videos on eyelid surgery.